Hello, my name is G Strong. I'm one of the nurses here, and I'm here to do a focus assessment on you. Do you mind verifying your name and date of birth for me?
Shane Miller, 52864.
All right. I'm going to be doing the focus assessment, like I said, on your heart and neck vessels. It's for my health assessment class here at Winston-Salem State University. Do you give me consent to record the video, the assessment, and upload it to YouTube?
Yes.
All right, thank you so much. And we already have your height and weight. You're about 5'10" and 195 pounds, is that correct?
Correct.
All right, and so we're going to get started. The first thing I'm going to do is check your vital signs, so we're going to begin with your blood pressure.
Okay.
And at any point, if you feel uncomfortable with the assessment and the recording, just let me know and I will stop the video, okay?
Okay.
Just clean my stethoscope out. Just relax your arm for me. All right. Excuse me. Blood pressure 136/80, so that's good. What I'm going to do now, I'm going to check your pulse. Push your watch back just a little bit. I'm going to check your pulse for about 15 seconds. Pulse is 80. Now I'm going to check your respirations. That's your breathing count. Respirations are about 18. That's good. I'm going to come over here and check your temperature. Temperature is 98.2. That's good. And as far as your health history, you just have a history of hypertension and you've had a right knee replacement. Is that correct?
Correct.
All right. And since we're going to be doing the focus assessment, have you had any chest pain?
No.
Any shortness of breath?
No.
Any palpitations?
No.
Any neck pain, tenderness, feel like your veins are popping out, anything like that?
No.
All right. So what I'm going to get you to do, I'm going to have you sit up, because we're going to go ahead
Turn
and...
like this
yeah,
way?
just right here in front of me, just for a second. The first thing I'm going to do is inspect your neck for just symmetry, any pulsations, make sure you don't have any lumps. Don't see anything there. I'm also going to palpate your trachea just to make sure it's midline. And it is. The next thing I'm going to do is I'm going to take I'm going to check your neck muscle strength. So what I'm going to do, I'm going to apply a little bit of resistance. So I'm going to ask you to lean forward for me. Lean back. Come lean over towards the right side. Excuse me, your left side. How about your right side? Now get your head, turn your head to the left, and now turn your head to the right. I'm gonna get you to give your shoulders a good shrug. All right. So what I'm gonna do now, just relax your shoulders for me. What I'm gonna do now, I'm gonna assess your carotid pulse. Well, I'm gonna palpate it first. And what I'm going to do is just check to make sure your pulses feel normal And so what I'm gonna do is, I'm gonna start on the first side, and when you do palpate your carotid pulse, you wanna make sure that you don't apply too much pressure to slow the heart rate down, or you don't wanna palpate both sides to decrease blood flow. So I'm gonna start on the left side. And you have a nice upstroke, pulses are +2. Come over here and do the same. Nice upstroke, pulses are +2. They feel the same on both sides. The next thing I want to do is listen for what we call a bruit. That's a blowing, swishing sound that indicates turbulent blood flow. So what I want to make sure is that we don't hear any bruits, because that would be abnormal. So what I'm going to do is I'm going to listen on the first side, on your left side. Here's the bell. Then no abnormal pulses heard there. Listen on this side. And I'm at your mid-cervical area. I'm just going to kind of go up a little bit to the angle of your jaw. And then at the base of your neck. And I'm going to do the angle of your jaw here. And the base of your neck. Alright, so didn't hear anything there. So what I'm going to do now, since that's the end of our neck assessment, what I'm going to do now, I'm going to just look at your chest area, and I'm going to inspect that area, listen to that area, and palpate it as well, okay? After I check your lymph nodes, so I'll come down here, palpate back here as well, and then come down your clavicle area. Don't feel anything there. So I'm going to have you, let me get something for your privacy, because I'm going to have to get you to lift up your shirt. So just lift up your shirt for me for just a second. And so when you inspect the chest area, you just want to make sure that you look for any abnormal pulsations. I don't see anything there. And what I'm going to do is palpate your apical pulse. And that's usually at the 4th or 5th intercostal space. So I'm going to come over here to your left side and find your apical pulse using one finger pad. And sometimes you may or may not be able to feel the apical pulse in obese patients or patients with a thick chest wall. Apical pulse is found. And sometimes sometimes you can get the patient to into left. We'll do that in a second. So now I'm going to assess your valve areas. You have your aortic valve, which is to your left side, your pulmonic valve, which is to your right side, and then you have your tricuspid and your mitral valve. So I'm going to listen to those areas. So I'm going to get you to lay back. And I'm going to elevate the bed back some to about 30 to 45 degrees angle. We're going to do the pulmonic valve first. That's at the right second intercostal space. You kind of use your clavicle as a landmark. That's about right here. And we're going to listen to the aortic valve, and that's right to your left. And then your tricuspid valve, let me just come over here for a second. That's to your left sternal border, left lower sternal border. And then your mitral valve, which is your fifth intercostal space, midclavicular line, your left side. Didn't hear any abnormal sounds there. I'm just going to palpate your chest for a second to check for any thrills, and that's a palpable vibration, usually like the throat of a purring cat, and that also indicates turbulent blood flow. And although I auscultated over those 4 valve areas, you can hear heart sounds all over the chest area, so you want to keep that in mind. And when you auscultate those areas, that's where the sounds are distributed with the direction of the blood flow. So also, when I want to assess you, I can get you to turn to the left just to listen for any diastolic murmurs, because when you listen, you want to also listen for S1, S2. That's the lub dub that you hear. S1 is the first pair of the heart sounds, and that's loudest at the apex. And then you have S2, which is loudest at the base, and that's part of systole as well. So when I listen, I want to listen for those, and I want to evaluate those separately as well. But also listening for diastolic sounds, and that's S3 and S4, so those are abnormal sounds, so you want to listen for those as well. So what I'm going to do is have you turn over to your left a little bit, because you can hear diastolic sounds best when you turn over to your left. Alright, and now I'm going to get you to sit up for a second. Also get you to just lean forward for a second, and then I'm going to ask you to exhale and kind of hold it there for just a second while I take a listen. And let it go. And also while I'm just going to go back and listen to auscultate your carotid really quick, just to check and get you to breathe in, exhale, and hold it to check for trachea sounds to make sure they don't mimic a bruit.
An EKG is needed in triage. An EKG is needed in triage.
Don't hear anything there. And when you're auscultating your heart sounds, you want to make sure you listen for murmurs, which are extra heart sounds. And if you do hear a murmur, you want to definitely describe the characteristics. You want to know the time. Did it occur in systole or diastole? You want to record the loudness, the grade 1 being the lowest, grade 6 being the highest. You want to also note the position of the patient, because some murmurs are heard in certain positions versus others. So those are some characteristics and things that you need to record when you're listening for a heart murmur. So I didn't hear any abnormal sounds, any murmurs, any clicks, because mid-systolic clicks would indicate mitral valve prolapse. All your heart sounds were normal, and that would conclude our assessment of your heart and neck vessels. Do you have any questions?
No.
So we just ask that you continue your blood pressure medications. If you have any concerns, please give us a call. We'll get your paperwork together, and we'll get you out of here. All right, thank you.
Thank you.